So in this video, I want to discuss the three most common reverse lunge mistakes that I see. A lot of people overlook the reverse lunge. Yes, it's typically better for those dealing with knee pain because a lot of the weight shifts back, but because the weight shifts back, there's actually a lot of problems that typically happen, and they usually go overlooked and not addressed, and then the patient doesn't really know how to perform the reverse lunge. So once you're finished with this video, you should feel a lot more confident coaching your patients through a reverse lunge. So by far, the most common error that happens with a reverse lunge is the incorrect trajectory of the front knee. So if you think about a reverse lunge, if you're starting with both feet on top, when the patient takes a step back, because their body weight is going back, the majority of the time, the knee moves in this negative trajectory. So the front knee goes back. When in actuality, as you descend, the knee should only go forward, and as you come up, it should only go back. So this means that as you go down, if the knee stops its forward motion and starts to go back, that's the end of the motion. So get your patient familiar with recognizing what's going on with their knee, and are they pushing it forward, and are they pushing it back as they should be. The second mistake that I see is now looking at the back leg. What should happen is as the patient goes down into the descending portion, the back knee should drop straight down. So the trajectory should be straight up and down like an elevator. But a lot of times people start moving it forward and back like an escalator. Now normally this happens when the trajectory of the front knee is wrong. So if you can clear up the first problem, you should be okay. But you really want to think vertical trajectory straight down like an elevator and then straight back up as they press through. The final mistake that I normally see, and this is actually with all lunges, is on the ascending part, so pushing out from the bottom. A lot of times people chicken it. So what I like to ask is, how does a chicken move? Chicken moves forward and backwards, right? So when people come out of their lunge, they really like to drop the chest and come up like that. This is just your spine using momentum and not really using the legs. If you're going to take the time to do a lunge, I'd say make sure you get the advantage of actually working the legs. So instead, when you come up, don't chicken it and stay nice and vertical. Now, if you're here down a little bit, that's fine. Just don't move from there. You don't need to be completely vertical, right, where you're almost going and extending, but you want to make sure as you come up, you don't chicken it, you don't drop through to lift yourself up.